Okay, so we all know health insurance can be a real head scratcher.
It is, yeah.
It's like, well, especially when you're trying to navigate this crazy system we've got here in the U.S.
Right.
But have you ever stopped to think about, like, how we even got here
Oh, yeah.
to
Yeah.
this whole employer-based health insurance thing?
It's a wild ride.
It is, yeah.
It really is.
So today we're going to do a deep dive into that.
The history is fascinating.
It is.
I think people would be really surprised.
Yeah. So let's rewind the clock way back. I'm talking like the 19th century.
Okay.
Like imagine hospitals back then. They were so different from what we're used to now.
Oh, absolutely.
Yeah.
I mean, back then, going to the hospital, it wasn't like, oh, I'm going to get better.
Right.
It was almost seen as a last resort.
Yeah.
They were pretty rudimentary places.
Yeah. And, I was reading that people back then, their main concern wasn't even medical bills.
No.
It was something else entirely.
It was the loss of income. If you got sick, you couldn't work, and that meant no money for food, rent, all the essentials.
Yeah, that makes a lot of sense.
Oh.
So that's where the idea of sickness insurance comes in, right?
Exactly. It was really about protecting yourself from those lost wages.
Like a safety net.
Exactly.
So was the U.S. like the only place doing this back then?
No, not at all.
Okay.
Germany, for example, they were way ahead of us.
Really?
Yeah, they actually implemented compulsory health insurance in 1883.
Wow.
It covered paid sick leave and medical expenses.
1883. That's incredible. Why was the U.S. so far behind?
Well, for a bunch of reasons. I mean, the U.S. labor movement wasn't as strong, and we didn't have a big socialist party pushing for these reforms.
Okay, yeah. The political scene was just totally different back then.
Very different.
So while Germany was kind of leading the charge with social insurance programs, the U.S. was, well, doing its own thing.
Yeah.
But even here, things started evolving, right?
Oh, yeah.
As we moved into the 20th century, hospitals started changing.
Absolutely.
They got more professional, like doctors were getting specialized training, medicine was advancing.
Yeah.
It was a whole new era for healthcare.
And it really shifted the perception of hospitals, too.
Yeah.
They were becoming places of healing.
Right. But of course, with all those advancements came a new problem.
Costs
Exactly.
and cost of care went up.
So what happened then?
Well, that's when Blue Cross enters the picture.
Okay, Blue Cross.
They started as a prepayment plan for hospital care.
Like a way to make it more affordable.
Exactly. They started by targeting specific groups, like teachers.
Interesting. So everyone was on board with this, right? This new system.
Well, not quite. The American Medical Association, the AMA,
The AM.
they weren't big fans of this whole third-party payment system.
Really? Why not?
Doctors back then, they were used to being independent.
Right.
They set their own fees,
collected
payments directly from patients.
Yeah.
So this idea of an insurance company, stepping in.
Yeah, middleman.
Exactly.
It kind of ruffled some feathers.
Yeah, it challenged that traditional doctor-patient relationship.
Yeah, that makes sense. And then, of course, World War II came along and shook things up even more.
Yeah, absolutely. I mean, the war changed everything, including healthcare.
In ways people probably didn't even anticipate at the time.
Right.
We're going to have to pause here for a quick break, but stick with us because we're just getting started on this wild ride through the history of health insurance in America. So we left off with World War II kind of accidentally creating the perfect conditions for employer-based health insurance to take root. What happened after the war? Did anyone even try for universal health care in the U.S.?
Yeah, it's interesting. After the war, you had this real split between the U.S. and Europe. Europe was devastated. I mean, cities were in ruins.
Right.
And they really saw the need for strong social safety nets, including healthcare.
Okay, so Europe's focused on rebuilding, and the U.S. is in a very different position.
Yeah, I mean, the U.S. comes out of the war as this global economic powerhouse, right? But even here, universal healthcare, it wasn't completely off the table.
Oh, really?
Yeah, President Truman, he actually made it a key part of his agenda.
So both sides of the Atlantic are thinking about healthcare, just from completely opposite starting points.
Yeah, and Truman, he really believed healthcare should be a right, not a privilege.
Right.
He'd seen the struggles of the Depression firsthand.
Makes sense.
He pushed for this national health insurance system.
A national health insurance system.
But he ran into some serious opposition.
I bet. Who was against it?
Well, industry leaders, for one.
Of course.
They weren't thrilled about the government getting involved in healthcare.
Right.
Saw it as a threat.
Okay, then what about the unions? Didn't they want healthcare for their members?
Yeah, but they'd fought hard to get health insurance as a benefit, through bargaining.
Okay.
And they didn't want to lose that leverage.
So even some people who benefit from universal health care weren't sure about it.
Yeah, it's complicated, right? And then there was the biggest opponent of all,
The AMA.
the AMA. They came out swinging against Truman's plan.
I mean, we already saw how they felt about Blue Cross, so.
Right. This time they called it socialized medicine.
Oh, yeah. I bet that went over well in the 50s.
Not at all. It was the Cold War. Everyone was afraid of communism.
Right.
And the AMA, they played that up big time, made it sound like national health insurance was one step away from, I don't know, Soviet Russia or something.
So smart, but kind of manipulative, too.
Oh, absolutely. And they didn't just talk about it. They hired this PR firm, Campaigns Inc.
Wow, they really went all out.
They did tons of ads, letters to Congress, you name it.
So what did Truman do?
He fought back. He talked about the moral side of it, that everyone deserves health care.
Yeah.
Eleanor Roosevelt even got involved, gave speeches and stuff.
Wow, big guns. But it wasn't enough.
No, the AMA's campaign, it was just too powerful.
So Truman's idea for universal health care, it just died.
Congress wouldn't pass it. They were getting pressure from all sides. Plus the AMA's campaign really spooked them.
Yeah, talk about a turning point.
It was. And the U.S., we went down a very different path, especially with Eisenhower.
Ah, Eisenhower. Dynamic conservatism, right?
That's him. He was all about private sector solutions over government programs.
And this is where things get really interesting with employer-sponsored insurance, right?
You got it. So remember how the IRS decided not to tax those employer contributions during the war?
Yeah.
Well, by the 50s, they were thinking about changing that.
Oh, so that sweet deal companies were getting might go away?
Could have, but Eisenhower saw it as a threat to the private insurance industry.
Which he was a big fan of.
Huge fan. So he went to Congress and lobbied hard to make that tax exemption permanent.
So instead of taxing it, he doubled down.
Exactly. It was a big win for the private insurance industry and for employers offering those plans.
And that's when it really became the way to get health insurance in America.
It cemented the system, yeah. Eisenhower called it the American way, compared to that socialized medicine boogeyman.
Right. So he wasn't just supporting it, he was trying to block any future attempts at universal health care.
Exactly. And it worked. That decision had huge consequences.
Yeah, for a lot of people who couldn't get insurance through their job.
Absolutely. Millions were left out.
And that's where Medicare and Medicaid come in, right?
Exactly. In the 60s, they were created to try and fill those gaps.
Medicare for the elderly,
Right.
Medicaid for low-income folks.
Right. But they were really just Band-Aids on a bigger problem.
So instead of fixing the system, we just kept patching it up.
Pretty much. And that brings us to today, and, well, you know the rest.
Yeah, it's a mess out there.
Yeah.
It's incredible how decisions from like 70 years ago still affect us now.
Yeah.
All right, so we've gone from those early sickness plans to, employer-sponsored insurance becoming the norm.
Right.
And then those Band-Aid solutions with Medicare and Medicaid. It's kind of wild how all these choices, from way back then, they're still shaping our healthcare system today.
It really shows how those early decisions can have a ripple effect.
Yeah, and one of the biggest ripples, the cost.
Oh, absolutely. The U.S. has the most expensive healthcare in the world.
And it's not even close, right? I mean, it's not like we're just a little bit more expensive.
No, it's by a significant margin.
And why is that? Like, what's making it so expensive here?
Well, a lot of it comes down to our system. It's so fragmented.
Fragmented how?
We've got this mix of private insurance, employer plans, government programs.
Right. Medicare, Medicaid.
Exactly. And all that complexity, it creates a ton of administrative overhead.
Oh, I bet. I mean, just thinking about all the paperwork.
Yeah, the paperwork, the billing systems, the negotiations between providers and insurers.
That's a lot.
It adds up fast. In countries with single-payer systems, those costs are way lower.
So not only do we have people struggling to afford health care, we're also paying more for a system that's, well, kind of a mess.
It's a bit of a paradox. We spend so much, but the outcomes don't always match up.
Yeah, that's the frustrating part. So what now? Are we just stuck with this expensive, confusing system?
Well, change is possible, but it's never easy, especially with something as big as healthcare.
Right. There are a lot of powerful players who benefit from the status quo.
Absolutely. But history also shows us that public opinion can shift. Things happen that force us to re-examine things.
Like the pandemic.
Exactly. COVID really exposed a lot of the cracks in our system.
Yeah, for sure.
It highlighted those inequalities in access to care, the financial burdens people face.
Yeah, even people with insurance were struggling. So
Yeah.
could that be a turning point? I mean, the pandemic, could it lead to real change in healthcare?
It's possible. Crises often force us to rethink things, and COVID showed us that healthcare, it's not just an individual issue, it affects everyone.
Yeah, we're all connected, right?
Yeah.
When one person can't get care, it impacts us all.
Exactly. So, while the future is uncertain, we can learn from the past. Change is possible, even in a system as complex as healthcare. But it takes commitment, a willingness to challenge the way things are.
And recognizing that health fears are right, not a privilege.
Well said.
So, there you have it. We've traveled through the twists and turns of American health insurance history.
From those early sickness plans to the rise of employer-based insurance, the battles over universal healthcare, and the patchwork solutions we've tried along the way.
It's been quite a journey. Hopefully, it's given everyone listening a better understanding of how we got to where we are today.
And maybe spark some thoughts about where we go from here.
Exactly. Keep those conversations going, keep asking questions, and most importantly, stay curious. We'll see you next time for another deep dive into the fascinating stories behind the issues that shape our world.